Doctor, let's just begin with news of Jayson Tatum suffering the ruptured Achilles tendon in Game 4 against the New York Knicks. Obviously, devastation here for Boston sports fans. Tatum underwent surgery right away within 24 hours. I guess let's just begin with, before we get to your study, from what you've seen over the years, does it help to get in there and get that surgery right away, or is there any difference?
Well, it's an interesting question because generally patients will go to the emergency room after an injury like this, but obviously with Jayson Tatum, he has the opportunity to have surgery right away. Unless there's extreme swelling or something that will compromise soft tissues, getting to surgery faster definitely allows all of the healing factors from the injury to be utilized. The biology, the milieu of inflammatory cells that help with tendon healing and just healing in general. Certainly biologically will help him heal faster, as well as getting onto the recovery process faster than having a 2 or 3 week delay.
Is there a timetable? Is there a different timetable from what you've experienced over the years to NBA players and any other athletes when it comes to this?
Well, certainly what's unique about NBA players is kind of the all around support that they have and the resources that they have. Typically, a recreational athlete may only go to physical therapy a few times a week. Jayson Tatum's going to be getting hands-on care around the clock from day one, therapy every day, other modalities. And so from a recovery standpoint, he has all of the right pieces in place.
Tell me about your study, for almost a 50-year study of NBA players with ruptured Achilles tendons. For our audience, just tell us how it came about and some of the results of what you found.
Sure. Achilles tendon injuries, they're not uncommon, but in the NBA, they haven't occurred all that much. Obviously, in recent years with Damian Lillard and Kevin Durant, there's some notable players who have sustained Achilles tendon injuries. We wanted to look, and our study came about after Kevin Durant's injury. We wanted to look at all of the NBA players who have had Achilles tendon injuries dating back to when statistics were really being comprehensively looked at in the NBA. So we went back to 1970 and then collected all the NBA players that have had Achilles tendon ruptures, and we compared them to matched controls. So at the time of injury, we matched those players to healthy players that had a similar age, similar position, height, weight, similar role on the team, and then we compared those players.
What were the results, and did it surprise you? Did any of the results surprise you?
Yeah, it surprised me a bit. So the majority of players do return to the NBA. We found 72% returned. And overall, when comparing those players to themselves, their pre-injury baseline, they played less game utilization. They had a reduced production, reduced performance, which we measured with the PER, the player efficiency rating, than their own pre-injury baseline. However, when we compared them to healthy controls, we really only saw that reduction in the first year. By the time we got out further to about 3 years after surgery, they had maybe played in less games or started in less games, but overall, their minutes played and their performance at 3 years after, when compared to healthy controls, was generally about the same. So the natural history of player performance declining with age, remember we were comparing them to controls who were also controlled by age, tended to not be there as drastically. That being said, players with Achilles tendon injuries did play less overall seasons after they returned from surgery than the healthy controls.
Does it help when the athlete is, a superstar player? Was that revealed? Like a Kevin Durant, obviously, was maybe done after your study, but it piqued your curiosity. He's a superstar player. Jayson Tatum is a superstar player. Do you think that can make a difference when it comes to overcoming some of these problems?
There are so many factors, many of which I'm not privy to, that go into these decisions. But I think it's common sense that if an organization has already invested so many resources and hundreds of millions of dollars into a player, such as a superstar player, they're going to be along for the ride. If you have someone who maybe is on a two-way contract or not making the cut, they may be very replaceable. And so I think that the factors that help Jayson Tatum for sure are his age. He's younger than, typically we'd see an Achilles tendon rupture occur in a patient who's in their 30s, perhaps. The game has changed as well. Back in the day, one of the earliest Achilles tendon ruptures we found in our study was Dominique Wilkins. And Dominique Wilkins was actually one of the only players in our cohort who had just an increase in production after his surgery. After he came back, his surgery and from his surgery, his performance was actually better than his baseline. That's not the norm. Now you see Kevin Durant doing amazing things after his surgery, and Jayson Tatum has that potential too, because now the game has changed. There's a lot more finesse, a lot more skill involved, a lot more shooting, and Jayson Tatum will still be able to utilize those aspects of his game, even if his explosiveness takes a step back.
So it's not technology, maybe it's more just the type of player. Do you think that maybe can help them become a better player after surgery?
Certainly, our surgical techniques have improved, and there are so many other things we can use to augment our surgical repairs with biologics, and we understand more about nutrition and recovery. But truthfully, a lot of it has to do with the player themselves, the work that they put in while they recover in their process, the support staff they have around them, the athletic trainers, the physical therapists, the unsung heroes, the nutritionists, all of those support staffs that are really at the patient and the athlete's side during the recovery process. And then, of course, I don't know how you would measure it, but the way that the game is played today might have a role in Jayson Tatum still being a very effective mid-range and three-point shooter and a skill player moving forward.
Were there any common themes in the study of players that never came back or had difficulties coming back as to why?
We don't have that kind of information available to us. This study was largely done utilizing news sources online to understand when the player returned and why they may or may not have returned. There are so many factors at play, contractual issues, agents, player age, and their own personal goals. So I can't really comment on that, but I do think that Jayson Tatum, with his age, his skill level, his superstardom, has a remarkable chance to come back and still be a very effective player. When
you look back on this study now, why the ACLs with NBA players?
Achilles, why the Achilles? Well, the Achilles tendon is extremely involved in powerful, explosive action. So jumping off of 1 foot, landing from, extreme heights, exploding into a change of direction move. And if you look back at the film of Jayson Tatum's injury, he planted that foot back in order to propel himself forward to go after a loose ball. And so we know that tendons rupture under an eccentric contraction. And so when he quickly planted that foot back, his Achilles tendon lengthened despite him attempting to contract it. And so those sort of sudden changes of direction, sudden explosive moves do put extreme tensile forces on tendons. And the Achilles tendon is prone to tearing just because of its poor blood supply, its attrition with time, with use. And so these NBA players put a lot of demand on it.
So let's just end it with, around here, everybody, like I mentioned, is down, devastated, tough. What's an optimistic outlook or something that you could give us to say, well, maybe he's got a shot to be like he was prior to the injury? Is it because of the age and everything else?
I definitely think the age. I definitely think that, in 2025, our surgical techniques, and not just the surgery, but the way that we heal patients all the way around from start to finish, including, all of the rehabilitation, the other modalities, biologic augments, nutrition, physical therapy, all the resources that they have now definitely are going to improve his outcome, improve his prognosis, more so than even my study, which is only dated a few years old, but looked at athletes from the 1970s. So definitely in a different world today. And I think that with his age and his skill level, he'll no doubt be a very effective player.
Doctor, thank you for taking a few minutes out. We appreciate it.
Yeah, thank you for having me.